Hello, my name is Cameron Farrand, and today I will be demonstrating IV medications via mini bag. So to start off, I'm just going to take a look at my patient's MAR. So Adolf Harrison, FIN number 123456789, has an allergy to shellfish. So to start off, I'm going to compare my MAR to my MD orders, which I've compared them both and everything matches. So to start, I'm going to perform hand hygiene and grab my medication from the Pyxis machine. And then once I've grabbed my medication, I'm going to start my first check. So I'm going to compare my vial to my MAR and see my patient Adolf Harrison, cloxacillin, 1 gram. This is a 2,000 milligram vial, or 2 grams. IV, this can be given IV, and then it's to be given Q6H, and it has not been given yet, so I'll give it now, and I can see that it is double transcriber signed. So once I perform my first check, I can go ahead and grab my PDM here and take a look at it. So for cloxacillin, it is an antibiotic, a penicillin. It may be administered by a student nurse, so I'm safe to give it. The dosage usually is 1 to 2 grams, and the maximum single dose is 2 grams. Now our dose ordered is 1 gram, so we're well in the safe ranges. Now for a 2 gram vial, it says to reconstitute with 6.8 milliliters of sterile water for a final volume of 8 milliliters and a final concentration of 250 milligrams per milliliter. I will then, for 1 gram doses, dilute in 50 to 100 mils of normal saline or D5W and administer over 30 to 60 minutes. And I've also taken a look at any potential hazards and seen that diarrhea, nausea, and hypersensitivity reactions are there. So I'm just going to be cautious and watch out for those. So then once I've taken a look at my PDM, I can go ahead and start and grab my supplies. So my syringe and my blunt fill needle. And opening both packages sterilely, I can make sure to sterilely attach them. Now once this is attached, as per PDM states, I will drop 6.8 milliliters of sterile water to add into my medication vial. So to start off, I'm going to set this down and grab an alcohol swab and swab the top of the vial for 30 seconds, let dry for 15. And then I'm also going to grab a new alcohol swab and swab my medication vial for 30 seconds, let dry for 15. And once they've dried, I can pull up my 6.8 milliliters of air that I'm going to need and inject it into my sterile water. And pull up my medication. So stabilizing my medication vial, I'm going to make sure that I don't have any bubbles. And I have my desired 6.8 mLs of sterile water. So then I can go ahead and insert it into my medication vial. So I'm going to insert my 6.8 mLs and then let the air come back up. So then I can go ahead and recap this and set this aside for a minute. Using the scoop method, I'm then going to roll my medication vial until it is all mixed in and I can see that there's no sedatives. And there's not, so then we're okay. And just in case I had touched the top of it while I was rolling, I'm just going to grab a new alcohol swab and swab for 30, let dry for 15 again, just in case. So then as per PDM, states that I now have a final concentration of 250 milligrams per ml in here. That means I'm going to need 4 mLs for my desired 1 gram dose. So I'm going to pull up 4 mLs of air into my syringe, and I can inject it into my medication, and then pull up my 4 mLs. I'm going to stabilize the medication, ensuring not to touch the needle at all, and get out any excess bubbles, and then ensure that I have my exact 4 ml dose. And once I do, I can go ahead and set my medication down and recap my needle, and then I'm going to write my label for my medication, and then I'm going to perform my second check. So I'm going to be comparing my my dose I've drawn up to my medication vial as well as my MAR. So for my patient Adolf Harrison, the medication is going to be cloxacillin. I can see cloxacillin and then cloxacillin on my label. It is a 1 gram dose. There's 2,000 milligrams in the vial, and as I checked for PDM, it's 250 milligrams per milliliter, which means that I need 4 mLs to get my 1 gram dose. And I can see here I have my 1 gram is 1,000 milligrams, which is 4 mLs, and I can see in my syringe that I have the exact 4 mLs that I need. So the dose is correct, and the route, so given IV, and it says it can be given IV, and then I have my fluid ready to be given via mini bag IV. As we're giving Q6H and Q6H, and it has not been given yet, so we will be giving this now. So then once I've done and performed my second check, I can go ahead and grab my supplies. So I decided to go with a 50 mils of normal saline, as per PDM states that it can be mixed in with. So then I am going to go ahead and dilute it together. So to start, I'm going to swab the top of my piggyback, or no, sorry, we don't need to because it's sterile. So I can go ahead and open up our syringe, and actually, yes, sorry. We're going to swab the top port for 30 seconds, let dry for 15, and then we can go ahead and uncap our syringe and inject it in. So once the medication is diluted, I can go ahead and throw out in the sharps container this syringe as we don't need it anymore. Then I'm going to flip our medication a couple times just to ensure that the medication is all mixed in. And then I can go ahead and attach my label. And then once I have attached my label, I can grab my secondary tubing supplies, anything I need for the bedside and my MAR, and then I'll enter to the patient's bedside. So then I will walk in the patient's bedside, set down my all my stuff here, and I'm just going to introduce myself, perform hand hygiene when walking in the room, introduce myself. Hello, my name is Cameron, I'm your student nurse and I'll be administering your medication today. I'm just going to ask you to give me your armband for a second so I can compare it to my MAR. So I'm going to check for Adolf Harrison, and FIN number 123456789, 123456789. And then I'm going to ask them to verbally state their name and date of birth, and then once they've stated it and it matches my MAR, we're good. I'm going to ask them if they have any allergies. They should say shellfish, and they have said it, so we are good to go. So after I've introduced myself, I'm going to just ask the patient to just wait for a minute. I'm going to do my third check. So I'm going to grab my mini bag here, and I'm going to look at my patient, Adolf Harrison, medication, cloxacillin, 1 gram, and this is 1 gram, or 1,000 milligrams, in the 4 mLs, and it's diluted in 50 mLs of normal saline for a total volume of 54 mLs. It is to be given IV, and I have my IV mini bag here, and it's given Q6H, and it has not been given yet, so we are going to give this now. So then once I have performed my third check, I can go ahead and just set this down and then educate my patient quick. So today you'll be receiving cloxacillin. It is an antibiotic for your infection. Some things to watch out for are going to be nausea or diarrhea. So if you experience any of those, just hit that call bell and let me know if you experience anything out of the ordinary. Now I've acknowledged that the patient does have the right to refuse the medication if they want, but however in this situation they have not, and they're good to go with the medication. So that once they have agreed to take the medication, I'm just going to assess their IV site. I'm going to look for any redness, inflammation, pain. In this case, everything is dry and intact, and everything is working smooth. And then I'm going to look at my tubing, ensure that there's no bubbles, everything is infusing properly as per MD orders. The pump is set at the correct rate, which as we check the MD orders, it is all correctly at the right rate. Infusing. So then once I have checked this, I can go ahead and grab my secondary tubing supplies. So once grabbing my secondary tubing, I'm going to start off quickly and by attaching it to my medication, my mini bag. So I'm going to sterilely open both ends and connect the two, ensuring that both ends are still sterile. So once I have sterilely connected the two ends, I can go ahead and hang up my mini bag, and I would start off by lowering my primary, and then I can go ahead and hang up my secondary, and then I can grab my tubing. I will insert before the at this port before the Baxter pump, as this medication will be regulated by the Baxter pump, so I will insert it before. And then I'm going to grab an alcohol swab and swab this port for 30 seconds, let dry for 15, and I can go ahead and uncap my secondary tubing and sterilely attach both ends. So once both ends have been attached, I can go ahead and open my roller clamp, and then I can back prime. So I'm going to lower my medication bag under the primary. Then once all the air is out of the tubing and everything is fully backed into my mini bag. I'm just going to flip it and empty my drip chamber to about halfway, and then I can go ahead and hang up my med. Now I'm going to program the pump, so I have a total volume of 54 mLs, so my volume will be 54 mLs, and then my rate, as we said, is as per PDM, it can be given from 30 to 60 minutes, so I'm just going to give it in 60 minutes, which means I need a rate of 54 mLs an hour. So once I've hit that and confirmed secondary, I'm going to wash my tubing and ensure at least 3 drips come out to ensure that the medication is infusing, and then again we have no air bubbles. And so I've seen now that the 3 mLs are infusing, and I'm going to program a callback alarm once the medication is infused to program another 15 cc flush at the same rate just to ensure that all the medications went through. I am then going to grab a piece of tape and label the tubing with my name and the date so that any other nurse who comes in will see when this tubing has to be changed. So after I have assessed the IV site again, everything is infusing good, there's no problems, then I'm going to do an exit safety check, talk to my patient and tell them again if you see any of those side effects, just hit that call bell. I'll make sure that their call bell is in place, their bed is lowered, and that there's no safety hazards around. And then I'm going to document in my MAR. I'm going to document my signatures and the time I gave the medication. And then once I have documented, I will also document any ins and outs or flow sheets and IPNs that need to be documented. And then that is the conclusion of IV mini bag medications.